everyone, and welcome back to our channel. Today, we are diving into a fascinating topic in prenatal ultrasound, the normal appearance of the fetal anterior abdominal wall. Understanding what's normal is key to identifying potential issues. So, let's get started. First, let's talk about what a normal abdominal wall looks like after the first trimester. It should be a smooth, continuous line. When you're scanning, you shouldn't see any abnormal bulges or openings. A crucial landmark is the umbilical cord insertion site. In a normal fetus, the cord inserts right into the middle of the abdomen. This creates a clean central attachment point. After 12 weeks of gestation, you should never see any abdominal organs, like the intestines or liver, protruding at this site. Now, this brings us to a really important concept called physiological bowel herniation. It sounds a bit alarming, but it's actually a completely normal part of early fetal development. Between approximately 8 and 12 weeks of gestation, it's common to see a small amount of the bowel temporarily looping out into the base of the umbilical cord. On ultrasound, this looks like a small, rounded bulge, usually less than 7 millimeters, right where the cord meets the belly. The key thing to remember is the timing. This physiological herniation is only normal during this specific 8 to 12-week window. By the end of the 12th week, the bowel should have returned completely back into the abdominal cavity. If you see bowel outside the abdomen after this point, it's considered abnormal and needs further evaluation. So, in the second and third trimesters, the rule is simple. All abdominal organs must be contained within the abdomen. The bowel, liver, and stomach should all be clearly inside the abdominal wall, with no herniation whatsoever. The umbilical ring, where the cord attaches, should transition smoothly to the abdominal wall without any defects. For my fellow radiologists and sonographers, here are a few tips. Always be mindful of the gestational age. What's normal at 10 weeks is a red flag at 14 weeks. When you see what looks like a herniation, be sure to scan from multiple planes to get a complete picture. A transverse view is excellent for confirming the cord insertion site and ensuring the abdominal wall is intact. To summarize, a normal fetal anterior abdominal wall is smooth and intact. The umbilical cord inserts centrally, and all organs are inside the abdomen after 12 weeks. Remember, that small bulge of bowel you might see between 8 and 12 weeks is just a temporary normal phase of development. I hope this overview was helpful. Understanding these normal findings is fundamental to good practice. Thanks for watching, and see you in the next video.